You gave your dog her pill, and an hour later you noticed she was drooling a lot more than normal. After contacting your veterinarian, you thought it was important to let someone know. But whom? If your animal is having an unwanted side effect, the FDA wants to hear from you. Side effects can be as mild as decreased appetite, a change in behavior or panting, or as serious as a seizure, collapse, colic in a horse, or death. Even if you're not sure whether a drug caused the side effect, we still want you to report it. At the FDA's Center for Veterinary Medicine, or CVM, your reports help us identify problems that could impact animal or human health. Now let's talk about other kinds of problems that you can report. An accidental exposure is when an animal or a person is mistakenly exposed to an animal drug. For example, a dog steals the container of his flavored pills and eats all of them, then develops diarrhea and vomiting. Another example is if a veterinarian draws up an injection of medication for a sick cow, accidentally pricks herself, and later has swelling and pain in her hand. It's important to carefully handle and store all medications. We want you to report side effects related to accidental exposures for both animals and people. When a drug doesn't work as it's supposed to, we call this lack of effectiveness. For example, your cat is given a dewormer for intestinal parasites, but at your follow-up appointment, the worms are still present. Or your dog receives a pain medication for arthritis, but it doesn't seem to help. You can also report a product problem, such as an abnormal color, damaged packaging, or a label that is missing an expiration date. Say you receive a refill of an injectable medication that you've been giving to your horse. When you take out the vial to administer a dose, you notice that the normally clear liquid is cloudy. This is a product problem that should be reported. A product problem can also result in an accidental exposure, like when a damaged vial leaks and the product gets on your hands. These are just two examples of why it's important to report the product problems you experience. Product use errors, also known as medication errors, are preventable and important to report. These can occur in the veterinary clinic, at a pharmacy, or even in your home. For example, a drug may be given the wrong way, such as by mouth, instead of on the skin as intended. Or similar drug names or bottles that look alike could cause confusion and lead to an animal receiving the wrong drug or the wrong dose. Your report can help us identify potential problems and explore ways to minimize errors. Side effects, accidental exposures, lack of effectiveness, product problems, and medication errors can cause harm. Now that you're familiar with what you can report, we hope you'll be more comfortable sharing your experiences with us. Your reports help us keep animals and people safe. For information on how to report, please go to the website on your screen. And remember, your report matters.